Okay, Dr. Liebowitz. My first question is kind of a broad one. How has the pandemic impacted the collective mental health of the country?
uh, in a very bad way, I'm afraid. Um, it's hard to get precise numbers, but I can speak, I think, from some epidemiology data and then from personal experience. If you look at the statistics put out by the Centers for Disease Control, for example, it looks like there's a big increase in things like anxiety, depression, traumatic experiences, suicidal feelings, substance abuse. All these things, these numbers are way up in the population as a whole, with particular impacts on selected subgroups, and we can go into that, in terms of age and ethnicity and roles and things like that. I have a private practice as well, and I'm just the increased anxiety and depression that my patients are experiencing really is pretty profound. And that fits with the epidemiology data because people who are already experiencing mental health difficulties are really very adversely affected by what's going on as well.
Okay. Um, I guess there's several different parts to it. There was the lockdowns, then there's the social distancing and masks while you are in public. There's still kind of a stigma behind it, gathering in groups. Does all these little things kind of collectively make it such a big mental health deal?
I think it's a couple of things. One is this disruption of normal life, and it fits because the people who are most disrupted are the ones who are having the most difficulty, and I think that falls on younger people as well, teenagers and young adults and things like that. For example, seems to be less problems amongst older folks who are still physically healthy, and less problems among people who are already retired. So there's less of a disruption in their life to start with. So I think it's just a disruption. It's the inability to socialize, the uncertainty around work and careers and dating, um, and then the constant health fears that people have as well. And again, some people are more worried than others, but a lot of people are just terrified of day-to-day interactions, and how safe they are.
Is that kind of, I mean, I guess we all know if you know someone who got sick, or if you got sick, or if you lost your job, or if you're financially in a hardship, that has obviously a negative impact. But does the not being able to just go out to dinner or go to the gym or do the everyday thing?
Those have big impacts too. Those have very big impacts. Our day-to-day physical and social activities and the routines that we've been in, I think, are important to a sense of well-being and connectedness. So not being able to do those things, for most people, are very hard. There are some people who tend to be a little more introverted or a little shyer or a little more reclusive who actually find find it helpful. There's less pressure to do things, but that's not a big part of the population.
Okay. Now, obviously, we have a mental health problem, and we've had it prior to COVID-19. How have patients who are already struggling with anxiety, depression, and other disorders reacted to just even more stress now?
With a lot of difficulty, I think. What I'm seeing is that people who've been fairly stable are much less so right now. We've had to change medication regimens. We've had to increase the frequency of counseling sessions. I've had to offer lots of emergency appointments uh, and try to make myself very available. And I think my colleagues are experiencing this as well in the counseling and psychiatry. Um, People reach out to me a lot with questions. Can I do this? Is it safe to do that? Can I? I'm answering a lot of things that are not strictly mental health, even, but just general support. What's safe, what's not safe, what is it okay? Struggles within a home. My husband wants to get back to playing tennis. I'm afraid of that. That kind of thing. So a lot of that. going on. A lot of decisions seem more important and more pressing and hard to figure out sometimes.